want to thank all of you for being here today. We have a very important topic that we want to discuss with you. My name is Steve Love. I'm from the Irving area. I am president and CEO of the Dallas-Fort Worth Hospital Council, and we represent the hospitals in a 17-county area. We're going to get to our panel in a minute, but the purpose of today's meeting is we really wanted to help educate each of you that are in this room to know something very important is coming up, and it's called the Enhanced Premium Tax Credits. And those tax credits have helped many Texans obtain health insurance in the individual marketplaces that normally they would not be able to obtain. They expire at the end of this year, and Congress must really renew them so they can continue. Very important. So, not going to talk about the big, beautiful bill today because this is separate and distinct from that. And we've been very blessed here in North Texas. We have a thriving economy. We have good healthcare providers. We have people that are very diverse, and we have wonderful communities here in North Texas. But this could be an impact, and you'll learn as we go through the panel discussion how it could affect you in a very negative way if these enhanced premium tax credits are not renewed. Again, thank you for being here. Appreciate your interest in this topic today. But before we begin to kind of lay the groundwork, I think we have a video that we're going to show.
Millions of Americans rely on enhanced premium tax credits to afford health coverage. In 2024, these tax credits helped 24 million people get coverage, keeping healthcare accessible for working families, small businesses, and more. But these tax credits will expire in 2025 unless Congress acts. If they're allowed to expire, millions of Americans will face a tough choice: pay much higher premiums or go uninsured. Without coverage, many will delay care until emergencies, leading to overcrowded ERs and higher costs for everyone. The economic impact will be severe. But we can stop this crisis. Congress must act now. Tell Congress to extend the enhanced premium tax credits.
Thank you for that video. We have a distinguished panel, and they come from different viewpoints related to healthcare coverage, healthcare access, and the real need to continue with enhanced premium tax credits. So the Honorable Vicki Byrd will start with. I'm going to let each of the panelists introduce themselves.
Hello, everyone. Good morning. I represent District 1 and bring over 30 years of public service experience to the community. As a retired educator and former law enforcement officer, as well as a health and safety officer, I am deeply committed to our community's health and safety. Thank you.
My name is Jennifer Kapinos. I'm the president of Denton Music and Arts Collaborative, known locally as DMAC. We're a 501c3 organization that helps to keep the creative heritage of Denton alive through assisting our members with health insurance costs through our fundraising efforts.
Good morning. I'm Steve Cobb. I've been a faculty member in the Department of Economics at UNT for the last 40 years. I currently serve as Divisional Dean for Communication, Media, and Performance in the College of Liberal Arts and Social Sciences, and I also direct our Center for Economic Education.
Good morning, everyone. My name is Kendrick, and I'm the Chief Operating Officer for Medical City Denton and Argyle. I've been in my role for about a year and a half, previously in the San Antonio market. In my role, I help support all the ancillary and support services, including OR and Cath Lab, and support business development and growth for the facility. I have the pleasure of being here for our CEO, Steve Edgar, today, he looked at who was going to be on the stage and he said, that's one too many Steves for a panel. So I'm very honored to be here, and he apologizes that he's not able to be here today.
Morning, everyone. My name is Brian Felty. I'm the Chief Market, Payer Relations, and Financial Officer for Southwestern Health Resources. We're a joint venture with UT Southwestern and THR, and our primary responsibilities are how can we manage members to a better access, better outcome in between primary care to when they present at the hospital. In my role, I have the unique opportunity to govern all of the managed care contracts for UT Southwestern and THR, so how we represent ourselves with the Blue Crosses, Uniteds of the world, and this is a very apropos timing for what's going on within our health system on strategy on how we want to look forward and being able to take care of members that unfortunately might lose access to care here much sooner than we expected.
Thanks. As you can see, we've got an esteemed panel, and they have different thoughts, and they're coming from different viewpoints. And that's why, to set the stage before I get into specific questions for each of them, I'm going to ask a question. I want each of you to respond, if you would, from your respective point of view. You know, 3.4 million people in Texas have utilized the enhanced premium tax credits to help them get their insurance. Many of these people are small business. Many people appreciate the large business and industry we have in North Texas. But 2 out of every 3 people that are employed in the country are employed by small business. And the enhanced premium tax credits help many of those people have good insurance, access to care, and at the same time, it's affordable. So I'm going to ask, starting with you, Councilwoman Byrd, why do you think affordable access to health care is so important and vital to North Texas?
You know, North Texas economic opportunities range very largely in some areas, and then there are areas of the North Texas region that are just mid-level people. And to be in a community like this where we've recognized that, you know, we're just a little bit more home style, hometown. We like that feel with the big city amenities right next to us and taking advantage of those. But the reality of our community is that we are really much of a middle-class community with both all of our public agencies here. And we know that these public agencies are not high-paying, you know, positions in a lot of ways. So that's the reality of it all. And being on the city council, you know, starting out as an individual that have lived here since I was 18, I came here at Texas Women's University, but to be able to experience the highs and lows of the economic impacts. Right now, where we are is a city that needs to take care of each other, wrap our arms around all of our small businesses to help them grow into, you know, their success. And doing that, the reason why I'm here is to bring this particular part to the community, because our health and safety and well-being is very much, you know, the core, you know, of who we also need to be. So I want to thank you all for bringing this program to us, allowing me to open this program to our community, because health and safety and well-being is, you know, what we need. It's not a want, it's a need. So again, thank you very much. And it is definitely going to impact us because of our economic status here in the North Texas area with this is a state-supported city for the most part. And then those large businesses are coming in, but to have this opportunity, thank you.
Thank
I
you.
hope I answered that question. That was a long answer, but thank you.
Jennifer, your thoughts?
I agree completely with what she's saying. You know, we have a lot of middle class people. We have a lot of low to moderate income people here, and that's who I primarily interact with DMAC, and they're all self-employed. They're their own little small business owners, and they need some assistance getting their businesses off the ground, and keeping them healthy and connected is what we're trying to do. It's a really rewarding endeavor, but it's hard. It takes some time to build a career and to make it flourish. Yeah, so.
Thanks. Steve?
We saw in the video the extent of the use of these extended premium credits, but what we don't often realize is that the impact in Texas is outsized. Texas is one of 10 states that doesn't have expanded Medicaid coverage, and it results in an even greater dependence on these credits. When the credits became available, enrollment in the marketplace grew by 255% in the state of Texas. This year, there's well over 3 million Texans that depend on these credits to keep health care affordable. And from an economic perspective, the choices that are going to have to be made if the credits don't get extended are huge. We'll find people either going without health care coverage, or the increase in the cost of their health care and their budget is going to impact all of our businesses because of the other things that they're going to have to give up in order to be able to afford health care. And so in a city like Denton, this is really a major economic issue.
Cole?
Yeah, when I think about healthcare and public health, there's really 3 foundational pillars that we focus on. That's cost, quality, and access. And here in Denton County, we have high-quality healthcare, we have access to healthcare, but across the nation and here in Texas, we still struggle with the cost of healthcare. And that's only going to intensify with the expiration of these enhanced premium tax credits. We specifically see that in Texas, as you heard previously, we're the second highest utilizer by state of the enhanced premium tax credits. And so this is going to be an impact that we feel at hospitals, our providers will feel it, our businesses are going to feel it, as well as our patients. And so it's something that we have to act on now, because the increasing cost pressures alongside the inflationary pressures that we've seen can be detrimental to a state, to a community.
Brian?
All right, last one. I'm going to take a little bit different, maybe more altruistic vision of this, but Jennifer, you mentioned it. It takes time and effort to build your businesses. What I see, my background's in economics, is it takes time and effort to build families. So with the access to affordability, it's not just individuals who are on this, it's opportunities for families to be able to get their kids access to affordable care. And I do worry what happens not just in the next year, but what happens 20 to 30 years from now. We're instilling behaviors in our children who don't have access to affordable care. The only way that they are then going to know how to seek care is delay it as much as possible or end up in the ER. And we'll talk some more about that in a minute, but I do worry about the long-term impacts and efforts of how do I learn how to use healthcare and my access to it. To me, that's a real concern when we look up decades from now, and I model it off of a lot of the consumer-driven health plans of the 90s and early 2000s, where if your deductible was $10,000, you weren't going to go see a provider. You didn't have preventative care. You'd show up when something acute happened to the ER. And that, from a just management standpoint, even with great quality and access we have here, this market's growing so fast, I'm worried we're not going to be able to keep up with the acute care need of not taking care of ourselves preventatively.
Thanks. And you can see there are different perspectives, but it's going to affect everyone. Everyone in this room can be affected if the enhanced premium tax credits expire. Okay, let's go to some individual questions. And Councilman Byrd, I've seen some estimates that just in state and local taxes, Texas could lose over $410 million in that revenue if we do not renew the enhanced premium tax credits. In Denton, looking at families, looking at businesses, just looking at the community, how is that going to impact access, treatment, and affordable health care?
It just sounds very tragic in the worst sense, but I'm just a silver liner. I look for the silver lining. I know that we're going to be okay in the long term, I guess, and we just have to get through it. So right now, all the cities are going through their budget cycles. We're getting prepared for the next year. We've already heard our preliminary budget talks on this past Tuesday. And I mean, you know, it's kind of depressing because we were doing kind of good. I am on the community development committee, and that's a committee that gets a chance to give funds away, you know, for our good times, our festivals and things like that. So that's impacting everything. We're going to be okay, but it's going to have to be a message that we're going to have to get through it. So I've been in conversation with our city manager's office, and you know, we're talking about making the marketing that, you know, we're going to have to get through it to get to it. And so having this opportunity to speak with small businesses, that's definitely going to be my message. And, you know, I think we can do it. Thank you.
You know, Jennifer, and you're a 501c3, you do great work helping artists and helping musicians in a lot of ways, but especially with healthcare. Can you share some real-life examples of how the extended premium tax credits have helped some of the artists that you know?
Sure. We've had several members that have dealt with life-threatening emergencies. We had a member who had to have surgery, and she recovered, and she had never had health insurance in her adult life before then. And we've got 3 members currently that are in various stages of cancer treatment, and without this tax credit, they wouldn't be able to afford to have the insurance that's helping them. All of our members utilize the independent marketplace, and we're currently supporting 60 people, and every single one of them will be priced out of healthcare if we don't extend these tax credits. So it's, you know, if that happens, then these people are, you know, your community members. They live here and they work here in Denton, and we would need to put our arms around them as a community and help provide some kind of buffer, because otherwise their health will decline rapidly.
You know, you bring up an excellent point, and I think people may not realize it. You know, enhanced premium tax credits need to be renewed before year end, but it's not like turning a water spigot on and off. Suppose someone's in the middle of chemotherapy for cancer. I mean, this is going to create such disruption in the overall medical treatment also. So that's very problematic, and thank you for making that point. You know, Steve, from an economic point of view, I've seen estimates that Texas could lose, as far as their GNP, $8.4 billion related to not renewing these enhanced premium tax credits, and close to 70,000 people could lose their jobs. What are your thoughts on that?
I think this is a question that we need to start nationally and work our way down to what it means for Denton. Nationally, we've got 24 million Americans that are depending on these credits in order to have health coverage. If we don't renew those credits, it'll cost the U.S. economy next year 285,000 jobs, GDP will go down by $34 billion, and overall output will shrink by $57 billion. The Texas share of that, we said, is $8.4 billion, but failure to renew the credits will decrease Texas economic output by over $14 billion, and state and local tax revenues that are so important to industries in Denton will go down by $410 million. So if we take this and look at Denton and our region, according to the Census Bureau, Denton already has 17% of our population that's without health insurance. And that number is going to significantly rise if we don't extend these credits, as we've already heard examples from Jennifer. Our families are already dealing with the rising cost of housing, of food, and of childcare. And from a demographic standpoint, younger workers, the self-employed, small business owners, and people in rural areas are going to be hit particularly hard. And if we go through that list, it sounds a lot like Denton. Economically, some of Denton's major employers are in the areas of education, healthcare, small businesses, and federal, state, and local government. And these sectors are going to be negatively impacted if we don't have the extension of these credits. The funding for federal, state, and local government and education K-12 and also higher education all depend on strong state, strong local economies that generate the tax revenues that support so many of these positions. The projected reductions that we were just looking at will negatively impact all of these institutions that are already on very tight budgets. At the university level, where I'm at, we've moved away from the idea that parents pay for their children to go to college, and it's now much more common that parents help, but that students are working their way through school. And a growing percentage for us, almost 50% of our undergraduates are first-generation college students that are working their way through school. Right now, 82% of our students are working more than 30 hours a week while they're going to school. The impact of a jump in the cost of health coverage may prevent some families from being able to provide this assistance and send their kids to college. While most university students are working their way through school, very few are in a position that they're working with an employer or working enough hours that they have health coverage. A lot of our students also fall into that group of self-employed because they're working in the gig economy. Health coverage isn't included in the packages for either undergraduates or graduate students, although we do have a university-endorsed plan. The cost is not inconsequential, and with the proposed end of these credits, we're going to see cost of these programs go up. Their budgets are already extremely tight, and a jump in health insurance cost may cause them to make that difficult decision and risk not having health coverage. We're a college town with a rapidly growing population. Denton has many young workers in our population. Some are self-employed and others are working for companies that are not large enough to have comprehensive benefit plans, and they'll certainly be negatively impacted if they don't get extended. The workers are often at an income level that currently qualifies for the extended premium tax credits, and they depend on these to have affordable coverage. And again, it's these young workers that in many cases will take the risk and drop their coverage if it proves to be too expensive. On the small business side, statistics show that 38% of marketplace enrollees are at income levels that they would lose these tax credits altogether if they expire, and these are our small business owners. It's a thriving sector in Denton, and a loss of these credits will certainly hit our small businesses hard. But Denton also has a thriving healthcare sector. two after me will certainly speak in more detail about that. But there are some concerns from an economic standpoint that would come with a failure to extend the extended premium tax credits. First, we find that without coverage, people don't take advantage of preventive care and regular doctor visits. It leads to more expensive acute care, as Brian and Cole already said. But for economists, poorer overall health and reduced productivity are the things that we worry about. Second, experts also address the increased cost of more medical visits for the uninsured and visits through the emergency room. The third thing specific to the healthcare sector is with estimates predicting that premium increases will be 50% higher for rural areas than urban areas, the financial strain on rural healthcare providers will increase. Many will be forced to close, and a city like Denton becomes the closest option for care. And so this means that cases will be coming to Denton from these rural areas more likely to be critical, more expensive to treat, and more likely uninsured. Economists also worry about the impact on the insurance sector of the healthcare equation. Insurance premiums are kept down by having a large, diverse pool of covered individuals. On average, young people are healthier and use fewer medical resources. It helps to offset the higher cost for the elderly covered. If major increases in premium force many younger, healthier individuals out of the healthcare marketplace, those that remain are more expensive to cover. This puts upward pressure on premiums and often forces companies out of these markets. It leads to both higher cost of health care for everyone, not just those in the marketplace in the future. So I think all of these are huge concerns in the Denton and the region around us.
You know, Steve, I'm going to do a follow-up with you. I talked to a friend of mine that works with some of the insurance companies in the individual marketplace. And because of the uncertainty, some are thinking about pulling out and not even participating. Do you see that as a real risk also?
So one of the things economists just obsess over is the idea of uncertainty. And we've got a huge uncertainty that's just been heightened in the last couple of weeks because I think there were a lot of us that were hopeful that as part of the discussion of the big beautiful bill that the premium tax credits would be extended. When this didn't happen, it created even more uncertainty in this market. We know we've got till the end of the year to do something, but the thing is that insurance companies are going to be forced to post their cost, their plans for the next year well before the end of this fiscal year. And from that standpoint, they're going to have to work under the assumption that they're not going to be extended, so we're going to see this huge jump in terms of the premiums. There's others that are going to see this as a reason to exit from the marketplace. And so, you know, in both cases, the increased uncertainty that's been created is going to lead to, we're already going to scare people out of insurance because they're going to see these elevated premiums. And in some cases, they're going to see fewer options available to them because there's going to be companies that will just pull out of the marketplace.
You know, Cole, you and I have talked about this before, but at the DFW Hospital Council, we have 90 hospitals, and I refer to them as collaborative competitors. They come to the table and work for the good of the community, even though they have their own market share they deal with. Medical City is no exception. But you're the COO of a prominent hospital here in Denton. Following up on what Steve said, does it worry you if the extended premium tax credits are not renewed, that people are going to put off preventive care? They're going to let things get so bad they come to the emergency room much later than when they should have initially had primary care. What are your thoughts on that here in Denton?
Yeah, absolutely. I think both Steve and Brian did a really good job of explaining some of the challenges that we anticipate with these changes. I mean, you look historically at some of our uninsured populations right now, and that's already a trend. They forego preventative measures or routine checkups with primary care because of the cost that comes along with it. And what that leads to is someone coming to the ER as their first point of medical contact when they're in a medical emergency. And what that does, it has a lot of challenges on the hospital side, both operationally and financially. So I'll start with operationally. Whenever you think about the operations of the facility, it's important for us to see people as quickly as we possibly can, get them the treatment that they need, and then triage them, whether that's inpatient or to be able to be discharged to get home. And as you have more patients that are coming in, they're at a higher acuity, they're much sicker, it creates strain on the system. And so you'll start to see backlogs and challenges in throughput whenever it comes to the ER. And whenever that starts in your emergency room, it trickles all the way down to your operating rooms, to your inpatient units. And so those throughput challenges can create delays whenever it comes to healthcare. On the financial side, I think about Denton specifically. Whenever we look at our inpatient unit, about 13% of our inpatients are uninsured. About 9% of our inpatients utilize these marketplace plans. And so just looking at the financial viability of the organization, if those 9% swing to uninsured, that's over 20% or over a fifth of our patients. And it's really hard for a business to be able to continue to provide the same level of services when you aren't being compensated for a fifth of your consumers. And so that's where you see these challenges really come to light. And it's going to be different based on hospital, because every hospital is a little bit different in their makeup. And so we think about Denton, we think about some of the DFW facilities, but if you zoom out and you think of it from an industry perspective, you look at smaller rural hospitals that are more dependent on the income and the revenue that comes from these plans. Those rural hospitals are at much bigger risk of potentially shutting down, staffing cuts, elimination of services. And when that happens, those patients then seek care elsewhere. And then those patients move on to the hospitals in larger cities or wherever the hospital is that can manage that load. And then they have to start going through some of those financial resiliency plans to discuss what can I continue to provide from a financial standpoint based on the reimbursement that's coming in based on my patient load. And as we've talked about previously, then that cost is shared among all of the other people in the market that are using traditional insurance plans, because you have to find a way to cover that cost. So these are real challenges that are kind of a downstream effect from people who would potentially not continue preventative care measures because of the risk or the fear of the additional cost that comes along with it if they were to be priced out of these plans.
Thanks. You know, Brian, many people may not realize it, but Texas leads the nation in the number of uninsured. We have more uninsured medically covered people in Texas than any other state. And so when you look at the big, beautiful bill, yeah, there are going to be some cuts to Medicaid, and it will impact Texas. But if we let these enhanced premium tax credits expire, it's going to be a much bigger impact. It's going to throw probably 2 to 2.5 million people potentially into the uninsured ranks where we already lead the nation. So with that preface, my question to you, Brian, as you look at it from your current role, is this going to create a problem? And it's a two-pronged question. If we let these tax credits expire, is that going to increase the crowds in the emergency rooms? And two, touching a little bit on what Steve said, then when you negotiate contracts with Blue Cross and Cigna and Aetna, et cetera, what's going to be that impact?
Yeah, great question. I think set up real well from what Cole said on just, you could hear the throughput issues and the downstream kind of ripple effects. We were talking earlier, you know, for many of us, it's that circular, almost death spiral potential. From the ER side, we're fortunate enough to be in a very thriving market, a growth market in DFW, and nationwide. You talk to many other healthcare systems, they're scratching and clawing to be able to stay relevant because people are moving out and moving away. So we are fortunate for that, but with that growth comes pressures. None of us have enough capital to be able to build the ERs fast enough to be able to take care of these individuals that aren't seeking preventative care. What we see within our health system is that when people come into our system that are associated with a primary care provider, their acuity index is 20% greater than those who don't have a primary care provider, but their stay in our facility on average is nearly 3/4 of a day less. So going back to that preventative aspect, if you don't have access to the preventative care, you put that strain on your local health systems. I represent 31 facilities here in DFW, and we are already at capacity within our ERs. On some days, we're sitting at 105, 110%. That's already a struggle with people having access to preventative care. And with these enhanced premium tax credits expiring, it's not just a decrease in premium, but many of them come with CSRs, the cost share reductions, meaning they get support in certain levels to reduce your deductibles in your copays. That's another big key to this, is that you have the ability then on your pharmacy, your prescriptions, to be able to get reduced cost share through these enhanced premium tax credits. So from an ER perspective, we are preparing for a unfortunately large influx of individuals. And Steve, as you mentioned, this was a growth 255%, you said, in 1 year, but it was 400% over the course of a few years. The problem is, it's not a slow growth that we've had. This is going to be a drop. This is going to be an immediate impact to those individuals on this plan. And that's what probably maybe Cole a little bit more as a COO of a hospital shaking a little bit more, because from a burnout perspective of staff, from being able to have enough capacity and access at our front doors is going to be a real struggle. And we need those in the community, and the state legislator, federal legislator, to understand that. And I think at this point it is falling on deaf ears, unfortunately, and how it's going to create just a capacity strain and an access strain within our system is tough. From the employer side, we have to backtrack. This has been going on for a decade. What was mentioned earlier from Steve was there were some monopolistic opportunities years ago from a few of the larger payers who were able to stay in the individual exchange. When it first came out, many payers jumped into this space. It was an opportunity for them to gain more membership. It did not bode well. There was greater utilization, greater cost expected within those plans than what they had planned for the prior year. So many exchange companies exited the market. That led to just 2 or 3 before COVID that were remaining. And what happened is they then used that pressure to negotiate with health systems to say, I have this volume. If you don't negotiate with me on this business, then you can't negotiate with me on our Medicaid, Medicare, or our employer business. So it really put strains on the health systems to say, I have to then, take discounts, do certain things for this plan. And where were the payers willing to shift that? Straight to the employers. Because over the last 30 years, instead of fully insured, meaning that you pay a premium and the insurance company is on the hook for it, many employers have said, I just want you to pay my claims. Do customer service, pay my claims. I'm going to put my premium in my own piggy bank, and that's what I'm going to use to fund health care for my employees. So what has happened in this shift, this paradigm, is when more employers move to where they're controlling their own dollar, then the insurance company is willing to put higher rates and push over to the employers for us to take their government exchange programs. What's going to happen is if all these members lose coverage and have to start going to employers, the gig economy is going to be very difficult. But for many small group entrepreneurs, their opportunity they're going to be priced out of even the employer health insurance market. And that's going to be a ramification that we're going to have to deal with.
I'm going to do a little follow-up with you, Brian. You made a point, but I want to make sure it resonates with everyone. The big, beautiful bill that does reductions to Medicaid, et cetera, Most of those go in effect 2 years from now. But if these expire, if these extended premium tax credits expire, when does it start impacting Denton, Texas?
I think it'll start pretty soon into next year. I mean, it'll be immediate. I think by the time you get to summer of 2026, that's when the facilities, the health systems will start to feel that strain. I think there will be a natural delay, just like anything else. I mean, we were talking when if your car's out of warranty or something going on, I delay getting that fixed, much to, my wife complaining about something. I'm like, I just deal with it for a little while. We have a natural tendency to delay, and whether that's delay care, whether getting things fixed. So I think we won't start to see the strain and the impact until 6 months in, but the individuals who are on these plans are unfortunately going to start to feel it pretty immediately.
Good point. We're going to go to the audience for questions, and I know you've got some excellent questions, and your questions are really the most important. But before we do, I'm going to let each of our panelists, kind of the way we began, and we'll start with you, Councilwoman Byrd. For this audience, what is your biggest takeaway that you'd like them to know why we cannot allow these healthcare tax credits to expire?
We cannot allow these tax credits to expire because we need each other. We need what each other has to bring into our inclusive society that we've set for ourselves. Exclusive, but inclusive society that we've set for ourselves. Our mission and our goal is to make sure that everyone feels successful here, and knowing that this situation is going to harm and hurt some of our communities, our friends, our families, and these people are very much close to us than we think. We rely on them for our entertainment. We rely on our educational sector, our K through 12, our ISD. We rely on our state school and Educare and our churches. And so all of these people, we all go together. And so that is what I'm concerned about, is us not having the ability to make sure that we are giving each other what we need as a society.
Your thoughts, Jennifer?
Well, from my slice of the perspective, the thing that we all love about living in Denton is this artistic community that we have around us. We have all of this wonderful musical entertainment, and we have these art events, and it's the thing that is the entertainment for Dentonites. And it's all created by people who, most of them struggle financially. They're trying to create a career for themselves here. And if these tax credits go away, it'll diminish the creative, artistic culture that we have here. It'll change it. They'll be forced in other directions. And I think that, we like to really tout Denton as a really special artistic place. We need to show up for the people who are creating that atmosphere for us.
Steve?
We like to think of this as a healthcare issue, but one of the things that maybe we don't understand about the extended premium tax credits is that they work to try to keep the portion of a family's budget that goes to health coverage at a manageable level. And the kind of estimates that we're seeing in terms of what would happen to the cost of health coverage is frightening. We're seeing a case where, it could be a family of four that makes $64,000 a year would see premiums rise by between $2,000 and $3,000. We see cases of 60-year-old couple in Texas that makes $80,000 a year. Premiums could go up $17,000 without the extended premium credits. I agree, Brian, that the effect on the health system may be delayed, and we may actually see a drop in terms of utilization as people stop taking the normal doctor visits. But when you have this kind of shock to a budget, the other aspects that have to be cut back are going to impact all the businesses across the state. And that's why those earlier numbers in terms of the impact on GDP, the impact on production, the impact on tax revenue are so important. And so we can't think of this as just a health issue. This is an issue that's going to have incredible budget ramifications that are going to force them to cut back on food and on clothing and all the other things that are part of their budget.
Excellent points. Cole, your perspective.
Yeah, thank you. Steve, you mentioned earlier about the collaboration of hospitals and healthcare systems in the DFW area, and that is very, very real. And we talked today about some of the implications that can come along with the expiration of these enhanced premium tax credits. And the hospitals in DFW are committed to continue providing care to the insured or uninsured, no matter what the population is, but they find themselves in a difficult situation where you have to look at the financial viability of the organization and what services can be provided. And our goal is to continue to provide as many services as we can to Denton County. That's something that we're very proud of, is we're continuing to build programs where Denton County residents can receive the highest level of care without having to travel to another county or another city. And so that's going to be our main goal throughout this, but there will be challenges that come along with it. And I think you heard a lot of the things and the impacts that you'll see from this if the credits do expire. But the thing that I want to make sure that I give light to that maybe we didn't talk to quite as much is the lack of knowledge that's around this issue. I think there's more conversation that's happening around the big beautiful bill, but not as much conversation around the impact to our communities and our businesses if these tax credits expire at the end of the year.
Excellent points. And I think, a lot of attention was on the big beautiful bill, but I wish we could get a lot more attention on these potential expiring tax credits. Brian?
Yeah, I think it's unfortunate we place this into it does almost become a little bit of partisan up in Washington and tax credits and all these things, and it's really not. I'd say the main fundamental piece to this is it's the human element. It's what was discussed earlier about those that are in receiving cancer care. What happens when they no longer have that coverage? We are forcing a decision to be made by individuals and families. For that 60-year-old couple you mentioned, $17,000 a year is $1,500 a month. I mean, I couldn't afford to pay $1,500 more a month for that type of coverage. It's just we're forcing decisions to be made on something that is, whether or not fundamental, all those things, politics aside, just it's about wrapping our arms around our community members. And being a Texan, I feel like that's one of our anchor tenets in who we are. And this, unfortunately, is moving past being able to take care of each other, and it's going to push to more, unfortunately, financial, economic, operational decisions that get made years from now because of short-sighted decisions that are made today.
Excellent panel. Now we're going to go to the audience. Your questions are the most important questions. Here's what we'd like. If you want to ask a question, please raise your hand, stand, and direct it to the panelists that you would like to answer it, or you can say this goes to the whole panel. But we'd love to hear your questions. Yes, sir.
Yeah, I'm happy to take that. In my role, I work a lot with employers directly to try and get past the middleman. And what we're seeing, just as a relevance for this group, I believe this region, TRS, so the teacher retirement system, is seeing next year an 11% increase in their premiums. So one or two things happen. You can stop offering, or you can push that cost towards employers or towards employees and make them pick up more of the cost share. With the expiring of tax credits, and if we lose more gig workers that have to go back and get, unfortunately, traditional jobs, I always tell my son, go do your thing. If you want to, don't be in a suit like me if you don't have to. But if we see that happening, you're going to put more employees on the employer payroll. Generally, the health benefits of an employer is the second largest line item in their expenses. You're going to push more of that to employers, and it's going to come to a point where, yes, there's a, maybe 10 to 15% increase, or what's going to happen is there's going to be I'm going to stop offering this plan, and maybe I'll give you a minimal individual contribution for you to go purchase your own insurance, but it's going to be less than what I give you today in your premium through an employer-sponsored plan, or I'm just going to bite the bullet, take the, the penalty from the IRS and move forward. So I think it's, without an exact number, it's going to cause two things. Employers to reduce their funding of premiums and push more cost share to the employees, or small businesses are going to make the decision of, do I continue to participate in an employer-sponsored plan? And that is, I mentioned earlier, the potential death spiral at play here.
The other piece of that one is that the biggest increase won't be the first year. It'll be the second and third year once we really see the impact on the health system, once we see how many employers move to just funding people to go get their own coverage, and the shrinking number of people that are in the marketplace that are available lead to higher premiums of those marketplace plans. And so it's one of those that even if we get an estimate, maybe 11% going into 2026, 2027 and 28 are going to be the time when we really see those impacts.
That was an excellent question. Thank you. Other questions? Yes, ma'am.
I'm happy to jump in, and please add on if you will. I think the action is to continue to talk about it. We're on a timeline. We talked about this previously, right? We hoped it would have been addressed with the most recent bill, but we have to have action by the end of the year, and pricing is already starting to be posted. So conversation is what's most important. I don't think these are conversations that are happening around the dinner table as frequently as they should. That's gonna make an impact, but the biggest impact is gonna be getting in contact with your lawmakers and getting involved. And I know that we'll have a QR code that we'll share. And so that gives you an opportunity to get aligned and then have a voice with our lawmakers to make sure that they understand the implications if action isn't taken.
It's a great answer. And, I was talking earlier with some people before we began. Congress and people that are in the legislature, I know it's easy to criticize and be a Monday morning quarterback, but they kind of have to know everything. And actually, I've talked to some Congress people that I had to explain what the extended premium tax credits were. And I said, well, you're going to be voting on this. So it's important that you, to reiterate with what Cole said, contact your U.S. senators and your House members and say, we cannot let these expire, and tell them your thoughts, especially on premiums, as you brought up. Even though you may say, well, I'm not using the extended, why does it bother me? Your insurance is going to go up. We have time, I think, for one more question. It was a great question. Any other questions? Well, I'll take the liberty of asking one, and I'm going to throw it out to the panel. What do you think's the biggest misconception of the general public about these extended premium tax credits? Any thoughts on that?
I'll jump in, and I think it's what you just said. I think it's a pretty complex issue, and I think there is this idea that there's a general understanding of the implications that come along with it. And I think even whenever you have conversations at the highest level at Congress, there's still some that don't understand what the future is going to look like if we allow these to expire. And so I think it comes back to education. I think it comes back to the people that are involved making the decision, making sure that we provide them the right information to make an informed decision when they vote.
That's a great answer. Steve, did you have a thought?
Yeah, I think the biggest misunderstanding is how widespread the need for these and how big the impact is. I think in general, the American population knows very little about them. And from that standpoint, they just ignore the issue. And so, I go back to what you said earlier, that we've got to get this as a point of conversation in our small business community. We've got to raise it with our representatives because right now it's just not at the top of the list.
Right. Did you have a thought, Vicki?
Yes, I do. I have had the privilege of being in front of our Congress members that represent our area in Washington, D.C. I've done that every time that I could to represent our city. And I've also had opportunities to go to Austin and go into the offices and make our presentations for our city to our members. And it is really a known fact that they sometimes do miss the mark because they're uneducated about, the processes. So what you all will have to do as a community, I'm going to say this to the entire wide community of the city of Denton, is that you've got to know who you're putting in that seat that is sitting on the dais at your city level, because we're the ones that our ears are closer to the ground quicker than anyone else's. So being in the same room with those people and having opportunities to remind them of who we are and what we need in certain respects is something that, we should all make sure that we are bringing the right people in to really talk about your needs. So keep that in mind as you all are thinking about who's going to be sitting on that dais for you to be the ones that are speaking for you and to have that particular understanding. So that's what I'll leave with the audience today.
I want to thank all of you for coming. I want to thank you for your interest, and the QR codes are there. And we hope that the takeaway for each of you would be to contact your political leaders, especially your House representatives and U.S. senators, about this extremely important topic. I also want to thank everyone that put this on and thank the Chamber of Commerce for continuing to bring good topics for discussion to the city of Denton and to the surrounding metropolitan areas. We really appreciate you. We appreciate what you do. We appreciate your interest. But I would be remiss if I didn't thank Vicki, Jennifer, Steve, Cole, and Brian. Let's give them a round of applause.